Universal Pharmacare. Is it a health policy that makes sense? A presentation created for UOIT by Brenda, Madison, Anushya, and Bashama. According to a study by Queen's University, 88% of Canadians like the current Canadian healthcare model. Canadians have a strong symbolic attachment to it and believe that the government should pay for the health care of all citizens. The health policy we are proposing would only strengthen that pride Canadians have in their healthcare system. In 1984, the Canadian Health Act was passed. Prescription drug coverage outside of hospital settings was not included in the Canadian Health Act, leaving an important gap in the provision of Canadians' healthcare. Canada is the only country with a universal public health insurance program that does not include prescription drug coverage. Universal Pharmacare would be a public health policy outlining the inclusion of many prescription drugs for all Canadians, thus adding value to current provincial and territorial Medicare. It would provide all Canadians with the appropriate prescription medications without additional out-of-pocket costs. Universal or National Pharmacare has been in the news. Both sides of the issue have been represented in the media. It is a topic on the minds of many Canadians. According to the Angus Reid, 85% of Canadians support adding prescription drugs to universal coverage. Do you yourself support or oppose adding prescription drugs to the universal health coverage of Medicare? The idea of public coverage for prescription drugs is not a new concept. In 1961, Emmett Hall was appointed by Prime Minister Diefenbaker to chair a Royal Commission on Health Services. The report was released in 1964, supporting a national medical insurance program, but it also recommended a national program that included pharmaceuticals. Although the national insurance program was accepted, prescription drug coverage was not. Research has shown that prescription drugs are a vital part of ensuring individual health. Many patients are refusing to purchase prescribed medications due to the high cost. This can result in an increase in mortality, morbidity, or comorbidity care costs. At present, there is no universal prescription drug coverage. Each province or territory has some form of drug coverage for specific demographics. There are inconsistencies in accessibility, eligibility, what and how much is covered, making it difficult to address issues such as population health. A national pharmacare program would draw on the strengths of existing programs with the goal of providing comprehensive coverage for all Canadians. On the issue of a national comprehensive prescription drug program, 3 options have been identified, which include continue selective coverage but make it consistent across the nation, the first option but add catastrophic drug coverage for all Canadians, or create a comprehensive national prescription drug program for all Canadians. The role of the federal government is to create a federal budget for prescription drugs. These funds would not be taken from existing transfers for hospitals and medical care. The universal pharmacare policy must be developed and implemented incrementally. Steps towards universal pharmacare could include coverage for drugs known for reducing hospital spending, such as antihypertensives. This will provide greater access, financial protection, and program efficiency, which embraces the principles of Canada's healthcare system. A national drug agency consisting of federal, provincial, territorial, and private representation would be set up. They would have 5 years to complete the objectives set out in the Universal Pharmacare policy. The National Drug Agency's objectives for the 5-year plan include create a national drug formulary, initiate national negotiations on drug prices, create a separate funding envelope, link medication management to primary health care, develop standards for the collection and dissemination of prescription drug data, and review the pharmaceutical industry's practices. Inevitably, there will be questions about this new policy. However, any questions can be resolved through a well-designed and efficiently run universal system. There is the potential to save billions of dollars and improving the health of Canadians by implementing a universal pharmacare program. Thank you for your time.